Okay, I'm going to go ahead and get started. So welcome everyone. This is Resident Forum for June. Today is June 15th, 2020. And my name is Jessica Lopez, and I'm going to welcome everyone. I can't believe it's June already, almost Father's Day. So happy Father's Day to all of you out there. First, I will start with an update on COVID activity. So in Fresno County, this again was updated as of Saturday, June 13th. We've had a total of 2,547 cases. That's an increase of 69 over the previous day's reporting period. So it is increasing. We have still not completely flattened that curve. And as we anticipated, that with unsheltering as well as increased testing, we're seeing an increase in numbers across the board in certain states, California being one of interest with a lot of increased activity as well. We're following suit in Fresno County. Of those cases, our travel related is the least amount now. Close contact, which they usually define as someone that they have spent a significant amount of time with, typically indoors, usually family, has accounted for 1,171 of those cases. So the majority of those cases are close contact. 959 are considered community spread or unknown, and 343 are under investigation. Total deaths to date by COVID is 52 for Fresno County. The total ever hospitalized is 261, and we are now up to 764 recovered. So the folks that have been monitored by our local Fresno County Department of Public Health to date is 4,760, and of those, they are currently monitoring 1,648. So that's an update from Fresno County. For San Joaquin Gardens, as of today, we still have 0 positive cases. We have 1 team member PUI whose results we're expecting to get back today. And for our Village Healthcare Center, we conducted mass testing last Thursday, Friday, and Saturday. That included 45 residents and 130 team members. Our cumulative data to date, as of June 15th, we have a total of 2 positive cases to date. Both have since recovered. Again, as you know, that was 1 resident and 1 team member. Our total PUI cases to date is 55. Our mass testing update. So again, we did mass testing in our Village Healthcare Center, June 11th, 12th, and 13th. During that time, we conducted 45 COVID tests on for residents, 103 COVID tests, including yours truly, for team members. We've had no positive test results, so this was just a baseline testing that's being done across really the country. It is a CMS, Centers for Medicaid and Medicare, required this to be done in all skilled nursing. So we followed suit. So of those, all that were tested that have any interaction with our Village Healthcare Center, we've had 0 positive results, 119 negative results. Of those negative results, this was interesting. Of those 119, 36 of them said negative, but with a caveat that basically said they would have liked to have gotten a little bit more DNA in the specimen to examine to truly say negative. So we went ahead and retested those individuals Saturday, Sunday, and today. So that means that we have a total of 65 tests pending. So these tests are being done through a lab that has been vetted by Human Good, and they are being done what we consider to be mid-turbinate, and that goes up 2 to 3 centimeters in the nostril. You basically are putting that up until you meet resistance, and then you're twisting that to collect a sample for 10 seconds in each nostril. And those specimens are taken, FedExed overnight to our lab on the East Coast, and then they're processing those results in 24 to 48 hours. So It's actually a very good streamlined process for our team members. We are paying for that out of pocket. For the residents, they will be billed to the appropriate insurance party. COVID-19 symptoms, as a reminder, that's fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, sore throat, loss of taste or smell, or gastrointestinal symptoms. Even though these might not seem like something out of the ordinary, like for instance, the one team member that was tested, she's like, you know, this kind of sometimes happens to me, had some gastrointestinal symptoms, and we just decided to be overly cautious and send her out for testing. You know, we'd rather be safe than sorry. We can do that with our team members because we are screening them daily and asking these questions of our team members daily. This is part of what is keeping our community safe. So the reason I keep reminding y'all of this is not that I like to hear myself talk, although you know I do. It is because I want you to self-screen yourselves and bring this to our attention. So if having a cough isn't normal for you, feeling suddenly short of breath, please, please, please bring it to our attention so we can coordinate with your healthcare provider to determine if COVID testing is appropriate. It's just so important at this time that we all self-monitor, report these things so that we can protect our community from COVID community spread. As a reminder, again, if you get tested or if you have these symptoms, please contact Valerie Epps or Carol Freeman. So we're seeing such a good job. You all are doing such a great job of wearing your mask to protect yourselves and others. And I know with all the articles I read, there is conflicting reports on how much protection that mask really offers. But at the end of the day, all the science is saying it does provide some measure of protection. So it's just so much better to be safe than sorry. I would rather see everybody wearing a mask. As some of you heard me talking as we were joining the call, I was so uncomfortable getting my hair done to the point where I don't know if I'm going to return to get my hair done because people were not wearing masks and were not taking precautions. And if everybody wears a mask and everybody screens themselves for those symptoms, we really could help the spread of COVID. So please wear your masks. Encourage your family and your kids and your grandkids to wear masks when out and about. You know, some people just feel like it is not necessary and that COVID is, you know, being hyped up by the media. And my stance has always been, I'm not willing to take that risk with somebody else's life. And so I will always do what's safest for others. And I hope more people do that. So again, thank you for wearing your mask. I want to talk a little bit about our reopening guidelines and refresh you all on where we stand with that. So California is still in phase 2.5, they're calling it now. We're moving very quickly to phase 3. They announced last week that they're going to be opening up nail salons and movie theaters and things of that. My personal opinion is that they're moving a little too fast, that they're not getting enough data on the first phases of opening before they move to the next. It would have been nice if they paused for at least 2 weeks so we could see the outcome of the COVID activity and the increase in infection rates before we proceeded. But I know that they were getting a lot of pressure from the economic downturn to move quickly, but that's where we stand overall. What does that mean for us? The biggest point I want to make is that our visitation guidance is still restricted. This is from the Fresno County Department of Public Health. This is from the Department of Social Services, the CDC. Everyone is still saying across the state that we really need to limit visitation. In fact, even in our non-California communities like Arizona, where that state has lifted visitation restrictions on the community that we have there, the executive director there decided to continue to restrict visitation because Arizona and Phoenix in particular has become such a hotbed of COVID activity that she didn't want to bring that into her community. So again, visitation is such a serious risk to our senior retirement communities that we really have to take a measured approach to this and develop a plan, which is what they are working on. So when will we open for visitors for all levels of living? So as a reminder, the more people who enter our campus, the higher the risk for community spread of COVID-19. I mean, that's just basic math at that point. The more people who come on, are the more risk that poses for us to spread COVID-19 activity. Probably the biggest thing that we've done that has impacted our ability to keep COVID off campus has really been limiting visitation and screening our team members. Those two things are the key to preventing community spread. So I would anticipate that this area will be the last area to become fully unrestricted. So what I mean by that is when we do get approval from the Department of Social Services to allow visitation, it's not going to be a free-for-all. There's going to be modifications to visiting, which will include visiting hours. It'll require people to make an appointment. Those individuals will have to be screened. Of course, they'll have to be wearing masks, etc. There will be no common area visitation on our campus. And there's a possibility that we will require ongoing COVID testing for anybody coming onto our campus, much like we're seeing in our Village Healthcare Center. So again, more information to come on this, but I kind of want to give an outline as to what would need to transpire before we open up completely for visitation. And as a reminder, visitation means anybody coming on our campus. So, you know, we've gotten phone calls of people saying, well, can they just come and sit outside my apartment and pick me up? The state considers that visitation. Anybody gaining entry to our campus where we no longer have, what would you say, a visual eye on them, they would consider visitation. So anyway, we are waiting for further clarification from the Department of Social Services. We expect to get that this week, but they said that last week, so I'm taking that with a grain of salt. But we are hopeful that we will get some guidance from the Department of Social Service on visitation in senior communities. But as a reminder, that is that is not an easy trigger to pull, and the reason it's not is it puts us at a higher risk for community spread. Again, the more people who come on our campus, the more risk for community spread. So as you know, we're still in phase 2 of our overall reopening. We're moving quickly into phase 3 as well, which is the salon opening. We are waiting for further clarification on the Department of Social Services on allowing gatherings, allowing the gym to open, etc. So again, we are preparing and planning for all of that in the anticipation that DSS will unrestrict those areas so that we can provide those services to our residents again. I wanted to explain a little bit about the CMS, or Centers for Medicaid and Medicare, and how they are looking at reopening skilled nursing, and to provide some background into why we did the mass testing that I just reviewed with you earlier. So phase 1 of CMS's approach to COVID has been that everything's been shut down. So no communal dining in our skilled nursing, no group activity, no visitation at all, etc. So really it is fairly shut down from a provider standpoint. So largely closed. But now what they've given is guidance for allowing some reopening. And that guidance states that if they've had 14 days with no cases of COVID, they will allow you to move to phase 2. If you've had cases of COVID, they are setting a higher bar, requiring 28 days with no new cases. And so what they did is said, we want all communities to do baseline testing by June 30th. They want all team members and all residents tested by June 30th, so they have a baseline of knowing if there is any COVID activity. If there isn't any COVID activity, and there remains to be no COVID activity for 14 days, those people can move on to phase 2, which will allow limited access to visitors with small numbers, some restricted hours, some communal activities with physical distancing, some group activities with physical distancing. etc. But what they're going to do is they're going to maintain this understanding, which is the baseline testing and then 25% testing of the population every week thereafter. So that's how they will know what phase they're in based on it with that percentage of testing if they had any COVID activity. So if every week a community tests 25% of their population, both residents and team members, and there is no COVID activity, they will stay in phase 2. After 2 weeks, they can go to phase 3, but any rise in infection rate takes them back to phase 1. So wanted to kind of explain that to everyone. Number one, so you understand, A, why we're doing mass testing in our Village Healthcare Center, but number two, because it is my belief that the Department of Social Services, which regulates the rest of our campus, will follow something very similar to this, is what we're hearing, but nothing is affirmed. So they might be looking at asking residents to participate in ongoing testing so that we can have a baseline and an ongoing percentage of the population included to determine if there is any COVID activity to allow for things to quote unquote open back up. So at the end of this call, if there's any questions about that, I'll be glad to field them, but wanted to let you all know kind of how skilled nursing and CMS is looking at reopening. I will say the other tidbit is that the state of Washington has already announced a phasing plan similar to what the Centers for Medicaid and Medicare have proposed. So our Washington community is going to be following suit and doing mass testing throughout their entire community and then ongoing testing. So there is now officially one state that has proposed that they're going to follow CMS overall in this guidance. So again, what does it look like at TSJG? As you all know, dining, we've started the pickup option on June 4th. My understanding, somebody asked me this earlier, I don't know if anybody from dining is on the call, but my understanding is that about 70% of our residents are taking part in the pickup option for dining. So most residents, even though maybe when you go to pick up, you don't see a large number of people, most residents are still opting to pick up versus delivery. So I'll get an update from dining on that to see if that's fluctuating in any way, especially as we get hotter. Our salon was allowed to reopen on June 9th with some guidelines that we have to follow. Transportation was opened on June 9th with some guidelines for physical distancing and infection control. And the pool has been open as of June 12th. At this time, to be very clear, we're going to be having some postings on the pool. Right now, you will sign up to utilize the pool at the concierge desk. It will be by appointment only. And right now, only one person or two people from the same household can be in the pool. Once we have lane markers, which will delineate 3 different lanes that residents can swim within, we can have up to 3 people in the pool at any given time. And to be very clear, there are no water aerobic classes being offered, scheduled, and hosted by TSJG at this time, meaning if a husband and wife from the same household want to go do their own water aerobics class in the pool tomorrow, that's their prerogative. But AJ is not leading any water aerobic classes because that would fall under the group activity guidance from the Department of Social Services, which is still restricted at this time. So again, the pool is open for 1 person or 2 from the same household. You will sign up at the concierge desk, and then once we get our lane markers in, then it will be up to 3 people in the pool at any given time. For activities, visitation, and the gym, we are still waiting for DSS approval. We are expecting that next week. I will hopefully have more information by our Thursday call, and our Human Good is putting together a protocol specific for our gyms so that once we get the green light, we're good to go, much like we were with the salon, and we can put those measures in place and open it as quickly as possible because I know folks are itching to get back into that gym. But I do want to remind folks that one of the best activities you can do right now is walking. All the research I read, and I just read a great article from the Blue Zone authors about COVID, and it was talking about how important it is to talk to our older adults about getting out walking because that's the best place you can be. It's great for vitamin D to get in that sun and have a nice walk in the morning or in the evening when it's not too warm, and get your aerobic activity in that way so that you are keeping your strength, but also that's the lowest risk for COVID exposure is outdoors and participating in activities such as that. Again, as a reminder that the edict team at TSJG is going to be working with all the chairs and the activity team members so that they can put together templates to follow for reopening guidelines. My apologies that this didn't get out on Friday as I had originally communicated, and that was because of me. I did not get the information to Michelle in time. So Michelle is going to get that out today and put in the boxes of any chair of any committees, and there's the COVID-19 reopening guidelines form that you can fill out along with the checklist to kind of talk through what it'll look like upon reopening. And if anybody has any questions, concerns, or thoughts, please feel free to reach out to me or Michelle or actually, Dennis Painter would be a great one if he's been working with us on this. So again, once these are completed, they will be turned into us, and the edict team will go through them at our weekly meetings and provide, I guess, another check to that process, make sure it feels good and it looks good, and then we'll have that ready to go as soon as the Department of Social Services gives us the green light. I wanted to give a financial review for May of 2020. So starting at the top of your screen, number 1 there, for residential living, we failed to meet our budgeted expectation of revenue in residential living by $3,979. Memory care failed to meet by $2,000, number 3 there. Number 4 is the one, and one that I talked about the most, which is our skilled nursing occupancy has diminished. We were up to 45 over the weekend, which is 7 less than occupancy, but we still just took a large financial hit in May because of that lower occupancy. So as you can see for number 4 there, we were $92,000 shy of our budgeted revenue goals. Number 5, as you can see, other source income, 157,000 above budget, or 519%. Doesn't that look amazing? And that is COVID relief funds from the government. So the federal government has sent, we actually have 2 individuals on the Human Good team that is working directly with FEMA and other governmental bodies to collect our funds for COVID relief. And they've been dispersing those on a monthly allocation to the communities. And for May, we had 157,000 relief that was sent. I think it was about 150,000, but that would have explains that variance. Number 5 there. For number 6, you can see that we failed to meet the amortization of insurance fees. This number I predict is going to grow, unfortunately, and we're not going to see the lapse in residential living census right away, like we did see with number 4 in skilled nursing, but we're now starting to see it in residential living, which is we have not been taking any insurance fees because we have not had the move-ins that we normally would have had if we weren't in a COVID environment. So number 6 reflects the change in occupancy and residential living overall, which is going to be the longer fix for our community, but a very important one for us to focus on. San Joaquin Gardens is actually one of 3 communities that Human Good overall is targeting from a marketing perspective, because we have the most opportunity for entrance fee collection that will be important to Human Good overall. So they're going to put, we are one of the 3 communities that are going to focus all of their marketing efforts on for 2020, because we and the other 2 communities will represent the bulk of the entrance fees they hope to collect for this year, so that overall we can say financially sound is Human Good. So the pressure on us, and there's going to be a lot of focus on us for entrance fee activity. So we really hope to see this line item go up in subsequent months as we get creative with our marketing efforts. Total revenue, number 7 at the bottom, 56,000 above budget. Again, really completely due to those COVID relief funds from FEMA. If we did not have those, we would have been desperately negative for the month of May. For expenses in May 2020, as you can see there on your screen, number 1, employee cost just shy of 184,000 under budget. That's completely due to the furloughs, to the overtime control that we've had put in place, asking team members to work 7.5 hours instead of 8 hours, and all of that was to keep us from having to do layoffs. We've been unfurloughing people, as you've seen, because we've had increase in needs. This is just really us being good stewards of our resources, so that next year, or at the latter part of this year, we don't plan for, we don't want to do a big increase for our residents, because obviously you don't want that and we don't want that. So we've had to really cut back and tighten things wherever we could to offset some of this negative revenue in the COVID department that the COVID has caused for us. Number 2, supplies exceeded budget by 8,600. These are a lot have to do with housekeeping supplies and other, infection control supplies. Number 3 is a positive variance of 39,000 in ancillary services, and that is directly correlated to our village healthcare center census. So because we were not doing the rehab, we didn't have to pay out rehab through this ancillary services line item. So we didn't pay our therapy partners, our pharmaceutical bills, etc., as highly as we normally would have. So that's because of that lowered census. Number 4 there, marketing 7,100 under budget. Again, we're not utilizing a lot of our normal marketing channels that we would have, including direct mailers, events, etc. Purchase services, number 5, under budget by 10,300. Again, due to expense control and trying to cut back wherever we could. Number 6, utilities under budget by 14,400. It was there was a few warm days in May, but that's a good savings there. Number 7, travels and related under budget, as you would expect. Nobody's going anywhere for any trainings right now. Number 8, rentals and leases slightly above budget due to some modifications to the trams and other repairs necessary. And then number 9, other operating expense under budget by $65,000, and this was a huge pickup for us in May, and that was a pickup in property. Our property finance allocation that they had overpaid in the previous year and is now coming back to us, as well as some bad debt recovery. So a couple of nice things that really fell our way in the months of May, and so that overall led to a positive variance of $311,000. So really an extraordinary operating margin for May, a positive variance of $382,000. Again, most of that due to some things that fell our way in terms of bad debt, property finance, insurance, and then of course the COVID relief funds. If those things all hadn't happened, that would most likely have been a negative number. But again, great job with the team. I shouldn't say that those are the only reasons. A lot of great expense control plans put in place so that we could offset the loss of revenue because of COVID. So all of that hard work, in addition to some things that fell our way, really allowed for that positive variance, the highest in the entire organization for a variance for May. I want to remind everybody about the birthday lunch. That'll be June 18th at 12 p.m. So you'll receive a Zoom meeting invite from Joe Hansen. If you did that, please give her a call, email so that you can make sure to be invited. But as a reminder, everybody will be receiving a special lunch that month, that day, to celebrate and honor all of our June birthdays. At the end of the call, I'd like to get your feedback, but Alexis and the marketing team did a campus-wide review to see how things looked from a marketing perspective, and made a list of their top 10 things that they would like to see revitalized as we look at how we are going to market ourselves to get some resident living move-ins and thereby those entrance fees that are so important to our overall financial health. This seems small, but it's one that I wanted to get your opinions on before we made a decision, which is, if you remember back in March, early April, the clinical team tied blue ribbons around all of the trees on campus, which signifies hope. Since then, those blue ribbons have withered and are looking a little tattered, so they were thinking of taking them off. However, I want to get your feedback on A, if you'd like to see them taken off, B, if you'd like to see them replaced with new ribbons, or would you like just a few ribbons? Because I didn't want to just remove them and everyone think, oh, is hope lost? What's going on? So we wanted to have a conversation and for you all to make a determination on what you would like to see in terms of those blue ribbons going forward. So at the end of the call today, we can discuss that. A sales and marketing update. I don't know if Alexis is on the call, but she's welcome to jump in. But we do have 3 deposits that we are expecting. Milano 328 to Wayne and Bonnie Green, Tuscany 294C to Jean Tuck, and Sequoia 110 to Betty Morosic. Somebody probably knows her and can do a better job. Our occupancy still is slightly challenged. As you can see there in the middle, independent living is at 96%, but that is going down. We've had some move outs. Assisted living at 94.5%. Memory support is at 107%, and skilled nursing at 90%. So we really are focusing our efforts on residential living. We've got to get some folks in the pipeline to get some move-ins there. So please refer your friends and your neighbors and anybody else that might be interested, because we have lots of availability. We have 4 apartments in Tuscany available. Sequoia has 6 apartments. Piazza 7 and Milano 8. So as a reminder, we have great 2-bedroom cottages available, which really rarely come available. We have large apartments and a lot of newly remodeled apartments. So if you've been talking to your friends about the benefits and the security that comes with living at San Joaquin Gardens, especially during this time, please let them know that we are still taking move-ins, and we would love to have them as a neighbor. For human resources, we have no new hires in the month of May. We do have some folks that have left us. Maria Martinez in housekeeping, Kiana, Anil, and Sia in the healthcare center, and Celeste, Barbara, Lorene, Jess, Jackie, and Valerie from home care. In dining, I wanted to, again, kind of walk you through what we're looking at doing due to COVID, which is phase one. We are in, actually not, meal and grocery deliver only. We're not there, but that was phase one. I'm sorry. Phase two is picking up grocery and meal options. We're currently in that phase, not in phase one, but we can deliver if you'd like. Phase three would be physical distance dining in our restaurant at less than normal capacity. And we're about to start staging that. And by our call on Thursday, we should have some pictures to show you as to what Speranza specifically will look like with that physical distancing in place in that restaurant. And then phase four would be unrestricted access to restaurants with no physical distancing needed. Wednesday, June 17th is National Picnic Day, so we will be serving, again, as a reminder, a really great lunch, which is cold fried chicken sandwich with Creole mustard sauce. Oh gosh, you guys told me what this. It was French sounding. I'm going to call it pasta salad. I'm mad that I can't remember how you guys said to say that. Farfalle. Oh no. Broccoli slaw watermelon. What was it?
Bow tie.
Bow tie. I can say that. Let's just change it. So bow tie pasta salad, broccoli slaw, watermelon, and an apricot orange bar. So happy National Picnic Day to all of you. And then as a reminder, again, this Sunday is Father's Day. This looks like an amazing menu for lunch that day. So again, if you don't normally get lunch and you want this menu, please let us know, because it's going to be a fantastic meal. And that will include tri-tip chicken, apple sausage, and barbecue shrimp, au gratin potatoes, broccolini and mushrooms, ham and corn chowder, a wedge salad, and chocolate mousse cake with a bourbon caramel sauce. That sounds amazing. So please call us if you don't normally get lunch and would like to have lunch that day because of that special menu. For building and grounds, so folks have been asking when we're going to get back to weekly housekeeping in Milano and Piazza. Sherry and Brian had been working on trying to source additional housekeepers and reallocate them. And apparently beginning next Monday, June 22nd, we will resume our weekly housekeeping schedule. So you can look for all of that for folks in Milano and Piazza. That's hot off the presses. When will we have the tram running again? The tram is now up and running. So from 11 a.m. to 1:30 p.m. and 3:30 p.m. to 6 p.m. The tram is running. I don't know how many of you have seen it yet, but it has been modified with plexiglass dividers like this between people and in front of people to prevent the spread of COVID. And they will be disinfected between each use. Again, we ask that all residents wear masks when utilizing the tram. And we have plenty of drivers for your needs. So if you have a transportation need to a medical appointment, please again schedule that at least 48 hours in advance so that we can have enough drivers here to provide that service to you. So again, you'll contact the concierge desk to calendar your transportation request, and we'd ask them for you to do them as soon as possible rather than waiting, but at least 48 hours in advance. Some poems for you, and this is again thanks to all of our roving reporters out there who continue to send great tidbits to share with your fellow residents. And so this says, wash your hands and cover your face. It's the quiet life now, we now embrace. Chorus delayed, I've not the time, you would complain. Now you have the time, the story's the same. Confined to home, what to do? So many choices, it's up to you. Brighten someone's day, they're only a phone call away. Write a friendly note, learn to cope. Plant some seeds, do a good deed. Encourage to keep our distance, walk to build up some healthful resistance. Make light work of household chores, then try to spend some time outdoors. Find a cozy nook, read a book. Rewrite some poetry, go online and have a spending spree. Do traffic patterns in the grocery aisles, maintaining a safe distance all the while. We may be forced to be socially distanced, manners aside in this instance, but we are not spiritually apart. Habits to change, here's how to start. Greetings now come with a simple wave. No shaking hands, our very lives to save. We will be lucky to come out of this pandemic alive, but oh, the stories we can tell of how we survived. When friends you were meeting, you may choose to see the namaste greeting. Simple and safe is a bit more formal. Welcome, world, to the new normal. So thank you to the resident who submitted that poetry for us all. We also have some funny things to share. So after the pandemic quarantine was lifted and kids could return to school, the teacher was asking the kids how their homeschooling went. The teacher asked little Johnny if he knew his numbers. Yes, he replied, my father taught me. Good, what comes after 3? 4, answered the boy. What comes after 6? 7. Very good, said the teacher, your dad did a good job. And what comes after 10? Jack. Today I saw an ad in the paper for free skydiving lessons, no strings attached. I said, ha, I'm not falling for that. And this one you might have to write down because it took me a little bit to get it. But did you know substituting a T in place of W in what, where, when answers a question to each? So again, substituting a T in place of the W in what, where, when answers the question of each. So once you write that down and see it, it's kind of an aha. And finally, tensions are high in the produce section as no one dares lick their fingers. Isn't that the truth? All right, with that, we will go ahead and conclude the formal presentation. And before we stop recording, if any of the directors have noted anything coming through in the chat, actually we'll probably stop sharing and stop recording and answer that. So Michelle, you can go ahead and stop.